Good afternoon, and thank you for joining us for today's webinar on genetic counseling for rare and undiagnosed conditions. My name is Marcia Lanes, and I'm a genetic counselor and medical editor in the Educational Initiatives Department at NORD. It's my pleasure to be your host for today's webinar. This webinar is part of our series of free educational webinars for patients and caregivers. For over 30 years, NORD has led the way in voicing the needs of the rare disease community. Our programs focus on education, research, advocacy, and patient services, and we do our work collaboratively with more than 330 patient organization members. To learn more about NORD or to access our resources and events, please visit our website at rarediseases.org. You can also follow NORD on Instagram, Facebook, and Twitter. This webinar is recorded, and we will make it available to all registrants in the next few weeks. You're welcome to share the recording with anyone who was not able to attend today. Now, I would like to welcome and introduce our speakers. Christine Macia is a genetic counselor at the Rare Disease Institute at Children's National Hospital in Washington, D.C. She's interested in pediatric counseling, specifically lysosomal storage disorders and inborn errors of metabolism, as well as reproductive genetics. Melanie and Kevin Wu are the proud parents of 1-year-old Jonathan, who has neurofibromatosis type 1, and Leah, age 3. They participated in genetic counseling via telemedicine before and after Jonathan's diagnosis. Melanie and Kevin work on the business side of healthcare organizations, with Melanie's focus on human resources and Kevin's on marketing. And lastly, Kelly East is a genetic counselor at Hudson Alpha Institute for Biotechnology in Huntsville, Alabama. She leads the provision of genetic and genomic counseling for research projects and clinical services, as well as the development of educational experiences and resources for healthcare providers, trainees, and patients. Our panelists will spend a few minutes sharing information to introduce the topic of genetic counseling for rare and undiagnosed conditions, and we will then address questions submitted during the registration period. Christine, I'll turn it over to you to get us started.
Okay, thank you so very much for having me here today. I am a genetic counselor and recent graduate of the University of South Carolina's genetic counseling program, and I'm going to speak a little bit about what genetic counseling is. In the pediatric world, I work closely with a geneticist to talk to families who have children or a child with features of a specific genetic condition or delays or autism that could have an underlying genetic explanation. I help them understand why we suspect the condition in their child. I speak a little bit about the testing that we can offer them and how the testing could benefit their family and their child. I typically provide a refresher on basic genetics and explain the different types of testing we can offer to confirm or exclude a diagnosis, and counsel about the potential results that we can receive and the implications of each. Once the results come back, I walk the family through them, educate the family about the condition and what the genetic testing showed, and provide support to the family if needed. Additionally, I work alongside a geneticist to make referrals to any specialist the family might need to see for their child's condition, recommend additional genetic testing if previous testing has been non-diagnostic or uninformative, and I connect families to resources or support groups that they might benefit from. How can genetic counselors help you? Genetic counselors and geneticists work together to provide education for families who have received a diagnosis of a genetic condition for their child. We speak to other providers who are involved in the care for the child to make them aware of the diagnosis and provide education if needed. We often refer to other specialists who should be involved in the medical care for the child and speak with them so that we can come up with a comprehensive care plan for the child moving forward. Additionally, we can connect families to other families or support groups in their community.
Thanks so much, Christine. Melanie and Kevin, we'll move on to you.
Hi there. I'm Kevin Wu. I'm Jonathan Wu's dad. We found out about genetic counseling through our son Johnny's 2-month-old checkup appointment at our pediatrics office. Our pediatrician had noticed light brown spots on his body. We had thought they were just birthmarks, but she had mentioned that this could have been a sign of neurofibromatosis, NF1. So she recommended us to make an appointment with a genetic counselor through Children's National Hospital. And then since then, our genetic counseling experiences have been great. We had our first appointment through telemedicine. And at that appointment, we met with a geneticist and our genetic counselor. Then we discussed questions about our family history, questions about Johnny, and then what NF1 is and how it can affect Johnny throughout his life.
And we did need to prepare in advance for the appointment just a bit. I did check to ensure that Children's was covered by our insurer. And I also, because we were in the middle of a pandemic, we did have to email our insurance information as well as send some pictures of our child in so that they could do an examination. We also had to make sure we had access to the internet and online resources for telemedicine as well. As we reflect on the experiences that we had, we would definitely say that it impacted our healthcare decisions for our son in the future. One thing that we are incredibly grateful for this experience was first of all, the diagnosis we were able to receive through genetic testing of NF1. So we're not uncertain about what might be going on with Johnny. We have the diagnosis, which I know is not always common for everyone to have a diagnosis, especially so soon. The second thing is we were connected with the Children's NF1 clinic, which is going to oversee Johnny's treatment throughout his life and monitor him. So they're one of the oldest running clinics in the United States, if not the oldest clinic. So we are incredibly grateful for the doctors there who are guiding us through our journey and ways to ensure we stay on track with treatment and his symptoms as his life goes on.
Thanks so much, Kevin and Melanie, for sharing that story. And now we'll move on to Kelly.
Sure. I want to reiterate, thank you so much for having me on and the opportunity to share a little bit about our perspectives in the world of genetic counseling for patients who either have a genetic diagnosis or are still potentially living with a undiagnosed genetic disorder. And that latter is really what myself and my team and our clinic deal with the most and have a lot of experience in and passion for, is the people who are living with undiagnosed disorders that have a suspected genetic condition that have not yet gotten a diagnosis. And the reasons for that are a couple fold. We work with a lot of patients who are at the very beginning of their diagnostic journey that have not yet had a genetic evaluation and have not had any or had very little genetic testing to date, where there's a lot of conversations that we have with those patients about what is the chance that the symptoms or the medical problems at hand are due to some underlying genetic condition. What's the chance this is genetic? And if it is due to some underlying genetic condition, what are the benefits of finding that out, of getting that diagnosis? How is that going to add to or modify or alter the current symptom-based diagnoses that a person might have? Are we trying to refine that, or are we trying to potentially change that, or just explain why those symptoms are occurring? Genetic testing is a big part of genetics evaluations, as it's been talked about already. Genetic counselors come alongside patients who are having genetic testing to help them understand what are the tests that are available, what are the types of results that you might get from those, and what are the benefits and limitations of that testing that is available and being offered. And then finally, what does this mean for family members? Genetics is kind of a family business. We share our DNA with our relatives, and depending on what's going on in a family and what genetic test results might show, it might or it might not have implications for others. And that's a big part of our conversations with families often when they're having genetic evaluations or they're thinking about genetic testing. But for, so some patients who we see are kind of at the beginning of their journey to trying to get a diagnosis, and we are still kind of going through a genetic testing process. But I also want to kind of bring up and talk about other undiagnosed patients that we work with often who may have already seen us before. They've had some genetic evaluation, they've had genetic testing already, and that has not yet been able to identify a diagnosis. So we think there might be something genetic going on, but we have not been able to find an answer and find the genetic cause. And for those patients, we essentially walked through that genetic testing process with them. But when we don't find a diagnosis, we will typically continue to engage with those families and talk about, well, what next? You know, if this testing that's been done hasn't found an answer, how suspicious are we that there's still something going on that either current scientific knowledge or our testing technologies haven't been able to find? And what are the next steps? Do we need to kind of watch and wait and reassess in a little while, or are there other things we can do to help try to get towards a diagnosis for those individuals if there's a diagnosis to be found? And like Christine was already talking about, one of the big roles that genetic counselors have is trying to connect families with resources. We're kind of their guide through their genetic evaluation and genetic testing process, but also trying to figure out, you know, what are the support groups and other families and other resources that we can get them plugged into to make sure that they're getting all the support that they can.
Great. Thank you, Kelly. And thanks everyone really for those excellent introductions. So now we're going to go to some of the questions that we've received from audience members during the registration. And it was interesting to see that we did receive a lot of questions about genetic testing and questions really about some of the topics that you've already touched on. So this will be an opportunity to maybe expand on some of your answers about these questions. So the first question that I thought Christine and Kelly might both want to respond to is, why should patients and family members have genetic counseling before deciding about whether or not they wish to have genetic testing? Would both of you like to speak to that?
Sure, I can start. And I think it's really important to have genetic counseling before going through the genetic testing process, because we are trained to break down the complicated information that comes with genetic testing into information that families of all backgrounds can understand. We make sure that we're giving a refresher on basic genetics, which some families might not have had since high school, and explain why the testing could benefit them, the limitations to the testing, and benefits and limitations to testing itself. Some of the pros might be we can get a diagnosis or exclude a diagnosis. Of course, the limitation would be we could come up with a negative result and therefore don't have a diagnosis for a child. And what do we do at that stage? I think that's really important for individuals and families to understand before they go through the process, that there is the potential that we won't find an answer and additional testing might be recommended.
Yeah, those are great comments. And I'll just add that, yeah, it's a lot about expectation setting, of making sure that patients understand, you know, what are the types of results that might get back and what are we going to do with those? But also that the bigger question of, you know, what's the chance this test is going to give us an answer? And, you know, making sure that patients understand what this test is looking for, and making sure that it's the right test for them and their situation. You know, unlike what we wish were true, there's not necessarily one perfect genetic test out there that's going to identify all of the answers in one test. There's lots of tests on the market. And so there's some decision making there around what's the best test for the right situation. And genetic counselors are often involved in helping families understand if there are multiple options on the table, which is the right testing plan for them, and what those various kind of possible outcomes are, and then what each of those outcomes would mean for them in the future.
Right. So thank you both so much for those detailed responses. Next question. Do patients need a referral from a physician for genetic counseling, or can they initiate the appointment? Melanie and Kevin, you spoke a little bit about this. If you would like to elaborate, we'd certainly welcome any additional comments that you'd like to make about that. And then I'd also like to hear specifically from Christine and Kelly about your perspectives on this. For example, if parents have concerns about their child's developmental milestones or other health issues, should they ask the pediatrician for a genetics referral? And that, I think, would be something maybe Christine would like to weigh in on.
So we'll speak to our experience. Although we did have a referral, I don't believe it was required by our insurance, and I'm fairly certain that it would all depend on your insurance and what they require. So for us, it was, I think, just like another specialist visit, which our insurance doesn't require a referral for. The genetic testing portion was a little bit different. There was a little bit more paperwork involved. And that wasn't necessarily referral, but just more information that we needed to provide around that for insurance purposes.
Right. It is very important, I think, to point out that there are so many differences with the different insurance providers. It's hard to have a black and white answer, but it's good to know what some of the possible scenarios might be. And then, Christine, did you want to speak about that question as well?
Sure, I can elaborate a little bit on what Melanie had said. It definitely does depend on insurance, and it might also depend on the clinic that you are going to, whether or not they need a referral or if you can self-refer. We see patients who have referred themselves or who have been referred from either their pediatrician or another specialist at Children's National Hospital. For example, if they've seen a cardiologist first and the cardiologist has some suspicion that there could be a genetic condition in the child, they might make the referral to genetics.
And then what about adult patients who have multiple health problems and they don't know if there's an underlying genetic cause? Should they ask their primary care physician or their specialist for a genetics referral? Kelly, I thought you might want to weigh in on this one.
Yeah, sure. So, one thing I tell anybody is there is no harm in picking up your phone and reaching out to a genetics clinic or a potential care provider. For our clinic, it can go either way. People can self-refer or they can get referrals from their providers. But we get a lot of phone calls from patients or potential patients that want to just find out from us, do we think that they would be a ideal patient, or could we help them? And I can't speak for all, but genetics providers are generally quite happy to engage and help try to figure out whether someone is a good potential patient or not, and give some of that feedback. But also talking to your providers about whether they think you might benefit from a genetics referral is also a valuable place to start. But if someone doesn't have a primary care provider or they're not able to have those conversations, I always want to encourage people to pick up the phone and they can reach out to these two genetics clinics themselves, whether or not they actually need a referral in place to be seen. The clinic will be able to help them guide them through that process. I will say, though, that having referrals and us having a relationship with a patient's care team is really useful, because at the end of the day, if we do genetic testing or we get a diagnosis, it helps us to have a relationship with that patient's other care providers, and a place where we can send records, and a place where we can talk with to a primary care provider or a pediatrician. We like having that relationship, but it, in a lot of cases, is not totally necessary.
Great. That's really helpful information for folks to know. I think that, they can reach out directly if need be. So we've received a few questions that point to what I think are some misconceptions about genetic counseling, and I want to give our panelists an opportunity to address these. One of the concerns is that genetic counseling is prohibitively expensive. Melanie and Kevin, if you would like to share a little bit about your experience related to this. And then Kelly, I wanted to see if you would like to talk a bit about insurance coverage in general for genetic services and how genetic counselors can help advocate for insurance coverage on behalf of their patients.
So during our appointment, I remember we were given a ballpark number of how much the genetic testing and counseling could have been, but we weren't concerned about the pricing. We really wanted to know, if Johnny had NF1. But luckily, fortunately for us, our insurance covered a good portion of the genetic testing and the counseling.
Yeah, and that experience is fairly common. Genetic testing can be very, very expensive, and not all genetic testing is covered by insurance plans, and that's a part of the piece of advocating for people seeing genetic counselors and getting care from genetics clinics. This is the type of medicine that we practice all the time. And so we are quite in tune with the landscape of genetic testing, different tests and different labs, and what the billing policies are to help try to help families navigate that process of genetic testing itself, because that's kind of the bigger, the place where you've got those bigger costs and those potentially uncovered costs. But I also want to make sure to separate the two aspects of it, of being seen by a genetics provider, whether that's by a medical geneticist physician or by a genetic counselor, or in a lot of cases you see the two together. But having an evaluation in a clinic, and then the other costs associated with the genetic testing itself, and those often come at the same time. A lot of times being seen by genetics professionals leads to genetic testing being ordered, but not always. And for patients that we see, we really try to kind of separate those before we see them, to make sure they know that by showing up in our clinic and having the evaluation and talking to a genetic counselor, they are not already committing themselves to having genetic testing. That's part of what we talk to them about, is what testing is available, what are the pros and cons, what are the logistics, that you don't have to already know that you're going to do genetic testing and you want to pay for it or have it go through insurance when you show up in clinic. We go through that with you. Usually when you're seen by genetics providers in a genetic counseling appointment or a genetics evaluation, those are, like we've kind of already described, that's a medical visit with a healthcare provider, which it's going to be variable depending on what clinic you're going to, of how they manage those logistics. But there are usually patient, friendly ways of getting those things covered, either by insurance or not. But the individual clinics will work with you on how those logistics go. But genetic testing itself is not, you don't have to already be committed that you're going to do that when you show up for genetic counseling.
Thank you so much for differentiating and clarifying how the services really are separated that way. So another misconception that we sometimes hear about is that genetic counselors give recommendations about family planning and childbearing. And Christine, I thought you might want to talk a little bit about this, because you work in the pediatric and reproductive genetics area.
Yeah, so that's a misconception that I hear many times when I tell people that I am a genetic counselor, is people say, oh, you tell individuals whether they should or shouldn't have children, whether they should or shouldn't start families. And that's not what we do at all in genetic counseling. We aim to educate families on the risk for their child to have a genetic condition, if there is a family history of one, if they are both carriers, say, reproductive pair wants to have a child and they are both carriers for the same condition, we can educate on their chance to have a child with that condition. And if there are options for them to find out either pre-implantation or prenatally if the child is going to be affected, so that they can make decisions for their family based on that knowledge. We'd never aim to direct a family to whether or not they should or shouldn't have children, but we rather aim to educate families and provide support to them so that they can make the best decisions for them moving forward when they want to start a family or start having children.
Thank you so much for that clarification. I think that's really important for everyone to know. So one more might be considered a misconception. Some people have mentioned that the word counselor in the word genetic counselor makes them think that genetic counselors are providing mental health therapy. And Kelly, I thought you might want to talk a little bit about what differentiates genetic counseling from mental health therapy types of counseling.
Yes, I'm happy to. And yeah, when you hear the word counseling and genetic counseling, it's not uncommon to kind of go towards the more mental health side of counseling. And then I do want to kind of dispel the misconception that is not what we do. We are certainly not trained in kind of doing full mental health counseling for our patients that we see. Part of why that word exists in our title is because, there are aspects of counseling that we do, but it is very focused around specific situations and genetics concepts. So, we have training to be able to come alongside patients and their families to help them understand what's going on from a genetic standpoint with either their own health or their family members' health, and able to portray that information in a way that's both easily understandable but also sensitive and empathetic, to come alongside them and help them cope with that information, understand that information, and also help families in some cases make decisions. There are decisions around whether or not they want to have genetic testing, or how they're going to use the genetic information that they get from genetic testing into their medical care or their lives or their family members' lives. And so we're kind of trained and equipped to come alongside them and help them incorporate genetic information and what's going on with their genetic evaluation into their lives and their healthcare. But we definitely do not then kind of shift over into providing kind of full mental health services. That said, part of a genetic counselor's training is being able to identify individuals who we're working with who might benefit from those mental health services that we do not and cannot provide. And so being able to kind of watch out for and look for situations where we think someone might benefit from those services and helping to get them plugged into those services is something that we are able to do.
Excellent. Thank you both so much for taking the time to clarify what some of those misconceptions, where they come from, and what really are the realities about them. So let's move on to a few more questions. Can genetic counselors help connect patients with support groups and research opportunities? First, Melanie and Kevin, I thought I would ask you if you'd like to talk a little bit about your experience related to this.
Sure. So what our genetic counselor really did was connect us with the clinic, which in turn can help us with, I think, both of those areas. And as a result of that connection, we are informed about the best ways to care for Johnny and monitor him. So, for example, because we were connected with the clinic, we now go see a geneticist and a team of folks every 6 months for Johnny. And we also get his eyes checked every 6 months as well.
And then Christine and Kelly, I wanted to ask if you would like to speak more generally about helping patients and families find support groups and research opportunities, and what patient organizations can do to best support families who are coping with a recent diagnosis.
Yeah, so we frequently see patients who have received a genetic diagnosis and are looking for either research areas that they can participate in, or really just places in their community that they can go for support. And genetic counselors have the training to be able to identify those resources in the community. If it's research, whether it's connecting them to a clinical trial or a group of medical doctors or researchers who are looking more into that condition, and getting them connected so that they can participate in that research and potentially benefit from what that research is eventually going to put out. And we also connect families who are newly diagnosed with families who have been living with a diagnosis for quite some time and who have graciously volunteered to be connected to other families and share their experiences. Because while we as genetic counselors can educate a family about the condition, it's another thing to really live with the condition and have someone in your family who is, part of your family living with you with that condition. So I think that brings a really different perspective that families really appreciate when we set them up with a family who's been living with a diagnosis. Gives them a different perspective and maybe some tips and tricks that have worked for them in the past.
Would you like to add anything to that, Kelly?
Sure. So, when diagnoses are made, everything that Christine just said is something that, genetic counselors are very well versed in trying to get patients plugged in. For our patients who we see who either we don't get a diagnosis in, or, in some cases we may make a diagnosis for a patient, but a condition is so unbelievably rare that there are not necessarily other patients that we know of that we can connect them to, or large support groups. We will also often plug patients in with organizations like the one putting on this webinar, where you've got collections of people who may not have the same rare disease, but they have that same experience of living with a rare disease, whether it has a name or whether someone is still undiagnosed, that can provide some of that both support community as well as being a place where they might could get involved in additional kind of research opportunities to try to, better understand what's going on.
Excellent. Thanks so much for offering those insights. So on to another question. Are there reasons to have an ongoing relationship with a genetic counselor, or is it usually just 1 or 2 visits? And Kelly, this is probably more up your alley.
Sure, I'm happy to help. And, with this question, and the answer can be kind of variable depending on a person's particular clinical situation and what's going on with either themselves or their family member. There are situations where someone gets a diagnosis and there is a specialized clinic that they check in with periodically that includes a genetic counselor. So in some cases, people who have a diagnosis may see a genetic counselor on some kind of routine basis because it's part of a specialized clinic for that diagnosis. For others, when a diagnosis is made, they may be followed long-term by their pediatrician or their primary care provider, or maybe their cardiologist, or whoever is kind of ringleading their care. And they may not see a genetic counselor again necessarily unless they have questions or something significant changes with their history or their life stage. So in some cases, it might be once genetic testing is over and there's a clear plan in place and they're passed on to another specialist, they might not see a genetic counselor again. But also when we think about the patients who maybe don't get a diagnosis, maybe we've done some genetic testing and it's been negative, or maybe there wasn't any good genetic testing for their particular clinical situation right now. We often, at least at our clinic, we like to see those folks back periodically. Genetics is a field in which we've come a long way, but there's still a ton we don't know. There's still a lot of genes out there that we don't well understand that might be contributing to disease that we're not smart enough to have figured out in 2021. And so for our patients who we don't get a diagnosis in, we often will encourage them to reach back out to us, every couple of years and at least have a conversation about where we are with their particular indication. Is there new testing that would be available then that wasn't available the first time around? Or maybe there, if someone had really good genetic testing, we have their data stored in a lab, maybe we can go back and relook at that data in a new way. So we do like to see undiagnosed patients back periodically because science is changing, and we're hopeful at some point we might be able to take them from undiagnosed to diagnosed.
Thank you. Yes, so important for folks to understand that things are ever evolving and changing in the world of genetics. So, new question. If someone has a concern about the risk for a genetic condition in their family, when should they see genetic counselor? For example, should they wait until they're thinking about having children? And Christine, I thought you might want to speak to this.
Yeah, so I think there is never a wrong time to see a genetic counselor and have those discussions, whether it's pre-family planning, you're actively family planning, if you're pregnant, once you have a child. We see kids at Children's National when they are 3 months, when they are 3 weeks, when they're 3 years, when they're 30 years old. And for individuals who have a genetic condition that runs in their family and they're thinking of family planning, again, never a bad idea once you think you might start considering having children, you've found a reproductive partner and those discussions have been had, to go see a genetic counselor and discuss, what is my risk for passing this condition on? Maybe you haven't had testing for it and want to start there. Can always start there and say, hey, look, I'm interested in testing at this point in my life, where maybe you weren't interested in it 5 years ago, 10 years ago, or maybe there wasn't testing that was available that long ago.
Thank you so much for clarifying those points. So now shifting gears to a little bit of a different kind of a question. And this one is about confidentiality of medical information. And the question is, how is the private medical information that patients and families share in a genetic counseling protected? And either Kelly or Christine, if you would like to speak to this.
Sure, I can answer this one. So being seen in a genetics clinic is very similar to being seen in any other healthcare setting where there are best practices as well as legal protections around your medical information being kept private and confidential within that clinic. So all of the, you might hear the term HIPAA, laws are in place around genetics appointments, just like any other healthcare that you're receiving, where the information that's shared is kept private and confidential. Genetic counseling and genetics visits, it's often a family visit. It's not uncommon that we see multiple family members at the same time, or that we're caring for multiple individuals who are related to each other. But it's important to know, though, that our relationship with each person is a direct individual relationship. And so we're very cautious in making sure that information is protected and not being shared in a way that we're not able to, or that we're getting permission to share information when we do.
Thank you very much. Another interesting question that has come up is, do genetic counselors give advice about obtaining health, life, and disability insurance before having genetic testing? Either Christine or Kelly, would you like to speak to this?
Yeah, so I can touch a little bit on that, especially in the world of pediatrics, where we're dealing with children who we might be getting a diagnosis for that could definitely have implications further down the line when they get older. We don't necessarily give advice about whether you should or should not obtain it, but rather we educate about the laws that are currently out there. For instance, GINA, the Genetic Information Non-Discrimination Act, is out there. And That protects private health insurances from discriminating against an individual based on their medical information or specifically their genetic information. So because you have a diagnosed genetic condition, they cannot deny you private health insurance or raise your premiums because of that. However, that doesn't protect against all insurance, for example, life insurance. So we do talk to families about what that would mean. Is this the right time to be testing? Because there is the chance that an individual won't be able to obtain life insurance, or they might have a really expensive premium for their life insurance. And weighing the pros and cons of getting testing now or waiting until the individual is older and has a life insurance plan in place to then move forward with testing.
Excellent. Thank you very much for explaining all of that. I think it will be really helpful for people to understand. So another question that we've received is, why should I get genetic testing through a doctor's office instead of doing an over-the-counter genetic test? And there certainly is a lot of interest these days in some of the opportunities for folks to learn about their genetics through a kit from home. But I thought it might be helpful to understand from the genetic counseling perspective what issues might come up around this.
So I would kind of lead out by just saying I think, like I said earlier, there are lots of types of genetic tests on the market that answer different kinds of questions. And one of the big kind of ideas there is, what question are you trying to answer by doing genetic testing? If you are looking to dig into your ancestry or something like that, there are some great kits on the market that can help. But if you or your loved one has symptoms and has what you think it might be a suspected genetic condition, those over-the-counter or through-the-mail tests may or quite possibly may not be the best test for answering that question for you. And a genetic counselor is kind of the ideal person that can help sort that out to figure out what are you trying to get at, what are your questions, and what's the right test for that situation so that you get the right information from it.
And I think another big thing is a genetic counselor can also help you understand what the test is and then what the results mean. Some of the tests out there aren't the most comprehensive. They might only be looking at the most common things that we see in a certain population. And so just because a test comes back negative for you does not mean that it eliminates any and all risk of having a genetic condition. And that's something that a genetic counselor can answer.
Thank you so much for that. I think that will be really useful to folks, whether or not they have a concern, about, a family member with a genetic condition or just interested in genetics in general. So we are closing in on the end of our time, but before we conclude, I want to share a great resource to help people find a genetic counselor in their local area or through telemedicine. The National Society of Genetic Counselors website at nsgc.org provides a feature where you can search for a genetic counselor by zip code, city, state, and clinical specialty. Simply go to the homepage that looks like this slide, click, you can see on the lower right-hand corner where it says find a genetic counselor, and that will help you get started. So in closing, I just want to offer my sincere thanks and appreciation to Christine, Melanie, Kevin, and Kelly for taking the time from your busy schedules to share your knowledge and experience with our virtual audience. Just a reminder to everyone that we will be sending a link to the webinar to everyone who registered, and you're welcome to share that link with others. You will also be receiving a survey about the webinar, and we do encourage you to complete it to help us plan future programming. Thank you so much for joining us today, and enjoy the rest of your day. Take care.